Hello, and welcome back to 90 Seconds Healthcare. With you is Dr. Samer Ellahham. I'm going to be talking today about waste in healthcare, 8 types of waste and examples. Before I proceed, and I only have one slide really today, it's important to remind myself and remind you that waste is not only a matter of efficiency. It's not only even a matter of decreased value as much as value is so important. Waste would affect the patient experience. Waste will affect the safety of the patient. Waste will have significant relationship to the healing and to the engagement of the patient. So all levels of patient healthcare interaction will be affected. A very simple slide, just kind of to go over this. There are 8 types of waste. The first one, as you can see, is overproduction. What we mean by this is producing or ordering more supplies, perhaps medications, or even tests than necessary, leading obviously to waste. And we call it the mother and the father of all waste is overproduction. A simple example is what happens so many times is such as ordering excessive quantities of disposable gloves, or perhaps when I think about it, unnecessary lab tests. Somebody comes in and they have headache, and then we jump to the MRI. A very simple muscular back pain, we jump to the MRI. Someone comes in and has, maybe a upper respiratory tract infection, simple cold, and we order, 100 blood tests. So all of these add typically no value, increase the waste, and may affect clearly the patient experience. And sometimes over testing, can affect the safety of the patient. So the impact can be huge. The second waste, as we go along, is waiting. And waiting is typically what patients perceive and talk about. Patients waiting for appointments, as I think about it, patient waiting for tests or results. And basically, the reason for this is typically inefficient scheduling, or probably as important, process delays. Examples are patients waiting in the emergency department. This is typically a very bad experience, as you can imagine, for extended periods of time for being seen by a healthcare professional, typically a physician. Now, the impact here can be a lot more than efficiency. Efficiency is very important, but the impact can be, I don't want to go to the emergency room. No matter what, I'm not going to wait for hours and hours. And as you know, this would depend on the acuity of the case, but still, waiting time is a key thing that patients feel and perceive. The third important aspect is what we call motion. And what we mean by motion is unnecessary movement of any healthcare professional, any caregiver, any staff. And there are numerous examples of this. One idea that comes to my mind is walking back and forth, say, to retrieve supplies or equipment during the patient care. And this again has to do with also the way the institution was built, the location of different things. So it's a little bit complicated. So examples are nurses repeatedly walking back and forth to a supply room to get items needed for patient care. And we see this not infrequently in healthcare, as you know. The next one, which is very important, is transportation. So motion is the emotion of the staff typically. The transportation is the unnecessary movement of the patient and also the staff or supplies, resulting for wasted time and resources. So examples here would be the transferring, especially of patient to a different facility areas for a test that could have been conducted on site, for example, or if the location is such that if you want to do the X-ray and you want to do, another test, for example, ultrasound, and a third test, they are not located strategically, and there is a lot of waste. And I think we can remember these things happening as physicians and even as patients when we had family members who were sick. The fifth one, which is very important, so we said overproduction, waiting, motion, transportation, and very importantly, the inventory. What we mean by this is excess stock of whatever, supplies, medications, or equipment that may expire or become, obsolete before use. And this does happen. There is no institution that I know of that doesn't get at one time medications that expire or anything else such as supplies that become obsolete. An example of this is surplus of expired medications in hospital pharmacy. And believe me, this happens, and I'm sure you are aware of it. The other thing which is very important, sometimes we call it rework, and sometimes we call it defects, and sometimes we call it errors or mistakes. Wherever you want to call it, what we mean by this is what requires rework or requires additional work to have resources to correct that work, whatever that work is. An example is medication errors that require additional nursing time to rectify, and this exists, and I'm sure you are aware of it. Another important waste, which is number 7, is over processing. And what we mean by this in simple terms is performing unnecessary or redundant steps in a process, perhaps resulting in a waste of time and effort. And this happens not infrequently. An example is the issue of signature. We want to have multiple signatures for a routine admin task, something very basic that's quite repetitive. And still, we have to have so many signatures, and maybe people don't even look at what they are signing, and forgive my transparency. And then finally, and we call this either skills underutilization or intellect, and there are many other ways to describe this. What we mean by this is the institutional, the clinic, the organization failing to utilize the full capabilities and expertise of any healthcare professional, any staff, any caregiver, resulting in wasted potential. And again, very important, and we need to keep that in mind. A simple example is involving nurses in care planning and decision-making processes, despite their valuable insights and experience in other things. And I'm sure you are aware of all of these wastes. So one more time, overproduction, waiting, motion, transportation, inventory, rework, overprocessing, and intellect. When you think about it, the waste is simply something that we ought to address, and address strategically and tactically. It affects what I described in other videos, what patients are expecting. Keep me safe, safety. Be kind to me, which is patient experience. Heal me, which is evidence-based medicine. And very importantly, engage me. Nothing about me without me. So as we can see, waste affects all aspects of healthcare. Addressing waste is important, and the simple, most important step in addressing waste is to be aware of waste, because many times we don't know what we don't know. So I advise you to share this video and obviously other videos from other colleagues. Do significant education in your institution to first let people know about waste and then address the waste. Have a great day and have a safe journey in the field of healthcare. Thank you so much.